What if the biggest barriers to cancer care aren't clinical at all? Today, we're talking about oncology nurse navigation and how addressing real-life challenges like transportation, cost, and access can impact outcomes just as much as the treatment itself. Welcome to Voices in Oncology from STO. I'm Aimee Faso, and today I'm joined by Amy DePue. We're here to talk about oncology nurse navigation and what it is, where it started, why it's become such an essential part to cancer care. So Amy DePue, RN, MSN, OCN, and CBCN is an oncology nurse navigator at the UNC Lineberger Comprehensive Cancer Center. She supports patients across the cancer continuum and plays a key role in advancing navigation programs, including rapid access initiatives designed to reduce time to diagnosis and treatment. Amy's work aligns closely with organizations like the Oncology Nursing Society and the Academy of Oncology Nurse and Patient Navigators. They have a focus on reducing barriers, improving outcomes, and addressing social determinants of health. Amy, welcome.
Thank you. It's nice to be here.
So, Amy, let's first get started with the history. Where did oncology navigation begin?
Oncology navigation really began in the early 1990s with Dr. Harold P. Freeman in Harlem, New York. He created the first patient navigation program to address barriers to breast cancer screening and follow-up, particularly in underserved communities.
And those barriers that he identified weren't necessarily clinical.
Exactly. He partnered with lay community members who became the first patient navigators. They helped patients with transportation, financial concerns, fear, and even mistrust of the healthcare system.
So really working to break down those barriers of care.
Exactly. And that model expanded significantly after the Affordable Care Act in 2010.
So financial toxicity also being a major issue.
It is. In fact, nearly 40 to 50% of cancer patients experience some form of financial toxicity, which can lead to delayed or even discontinued treatment.
Wow, that's significant.
And it's why early financial navigation is so very important. It reminds me of the patient who told me she wasn't sure if she had enough money to get to her oncology appointment or if she should buy food and groceries for her children. The Centers for Medicare and Medicaid Services have introduced Principal Illness Navigation, or PIN. This allows reimbursement for navigation services for patients with serious conditions like cancer. So it really validates the role of navigation and supports long-term sustainability. Social determinants of health are central to this work. We're talking about transportation, financial stability, food insecurities, housing, health literacy, and access to care. Some estimates suggest up to 80% of health outcomes are influenced by these factors.
Wow. Can you share an example of how navigation makes a difference in real time?
Yes. I think about a patient with a new breast cancer diagnosis. She didn't have reliable transportation, was overwhelmed by the system, and she had concerns about the cost. Through navigation, we coordinated her imaging and consults quickly through a rapid access pathway. We connected her with transportation support and financial resources early on. Instead of weeks of delay, she started treatment much sooner. And just as importantly, she felt supported, informed, and seen.
That really brings it all together, the clinical care, the access, as well as the support. If there's one takeaway that I'm hearing, oncology navigation isn't just helpful, it's actually essential. Addressing barriers like cost, access, and transportation can not only just impact overall outcomes, but this is just as important as the treatment itself. As always, here is the voice that matters, a patient's words in the voice of their navigator.
When I was diagnosed, I didn't know where to start. I was overwhelmed. My navigator helped me get to appointments, understand my treatment, and find financial support. I didn't feel alone, and that made all the difference.
That's why this work matters. Amy, thank you so much for sharing your expertise today, and thank you for listening to Voices in Oncology from STO. To learn more or to tell us what you'd like to hear next, visit sto-online.org.
Voices in Oncology is produced by the Society for Translational Oncology, STO, for educational and informational purposes only. Content does not constitute medical advice and should not be used as a substitute for professional clinical judgment. The views and opinions expressed by guests are their own and do not reflect the official position of STO. Mention of any product, service, organization, or therapy does not constitute an STO endorsement. Clinicians should exercise independent judgment in applying any information discussed to patient care.